Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will start course in urine analysis, microscopic urine analysis part 1. In this course, our objective is how to identify the variable that can impact urine microscopic test result and how to describe the microscopic techniques used in the examination of urine sediment, identify urine sediment constituents, and correlate sediment constituents with physical and chemical result, and identify potential source of errors in the identification of cellular elements in microscopic urine sediment analysis. So we have 5 objectives. We need to discuss what are the variables that affect microscopic urine analysis. There are many variables that can affect the microscopic urine analysis result, which may impact the accuracy of test result. First, a suboptimal urine collection can affect the accuracy of the urine test result by introducing contamination, bacteria, or epithelial cells from skin or vaginal secretion into the sample. Second, preservation. Preservation of urine is essential for reliable assessment of urinary sediment. So, if the urine sample is not processed within 2 hours, it should be refrigerated. Why? Because red blood cells and white blood cells may be underreported as a result of lysing that occur, particularly if the sample over 2 hours has low specific gravity and or alkaline. So if the sample has low specific gravity and or alkaline, after 2 hours the estimation of red blood cells and white blood cells will be underreported. The most important issue also, bacteria may also be proliferated in an unpreserved sample that held at room temperature for more than 2 hours. So now here you have 2 important issues. First one is the collection of urine. The patient should know exactly the proper way how to collect urine. So you need to provide the patient with a clear instruction for urine collection to avoid contamination with bacteria and epithelial cells from skin or vagina. The second, urine collection time is a very important factor that may affect the urine analysis result. More than 2 hours, urine should not be processed unless refrigerated or preserved with a suitable preservative. So it is better to process the urine sample within 2 hours to avoid the underreporting of white blood cells and RBCs and bacteria in the urine. This we can call a pre-analytical phase variables. Now we will discuss other variables that may interfere or affect the microscopic urine analysis in analytical phase. First one, mixing of the sample. Second, sediment preparation method, volume of sediment examined, number of field examined, and method or equipment for examining the sediment, and final one, result reporting, which is post-analytical phase. So this 5 is analytical phase, and the 6 here is the post-analytical phase. Now we will see the standard practices that may affect the urine sediment examination and what is the potential errors if standard practice is not followed. First variable is mixing. Urine specimen should be mixed well before starting centrifugation. Inadequate mixing of the sample will falsely decrease any recovered elements, especially if the urine is not immediately processed following collection. So the urine sample should be mixed well before starting the procedure of centrifugation to eliminate the falsely decrease of any of the sediment. Second, specimen volume and centrifugation. The standard volume, you need 10 to 15 ml of urine sample to centrifuge. And the centrifugation time in most laboratories is 5 minutes at 3,500 RPM. So 5 minutes at 3,500 RPM, this is the standard for centrifugation. Inconsistent reporting between testing personnel may be because the personnel or the lab staff is not following the standard operating procedure, either the volume or the centrifugation time and speed. So all lab staff should follow standard operating procedure. Otherwise, the reporting will be inconsistent between the lab staff. Volume for resuspension. Lab staff should decant a standard volume of centrifuged urine as defined in the standard operating policy. So, if the standard operating policy mentions that you need to leave 1 ml to resuspend the sediment, all lab staff should follow that volume. Not 0.5, not 0.6, not 1.5. We should all follow the same volume of urine. Otherwise, this will lead to, if the volume left for reconstitution is large, this will decrease the number of formed elements per field. If the volume is low or less, this will increase the sediment element. To avoid inconsistent reporting between lab staff, the volume for resuspension should be mentioned in the SOP and all staff should follow that. Volume for examination. Glass slides and cover slip are used. Use a calibrated pipette for delivery a sediment sample. This volume also should be mentioned in the SOP that 50 microliter or whatever, 60 microliter or 20 microliter be used, and all follow the mentioned volume for examination. Otherwise, too much or too little urine sediment will cause uneven distribution of element around the slide if you are using glass slides and cover slip. Or, to avoid this inconsistency, you can use a pre-calibrated slide which held a specific and fixed volume. Now let us to see question number 1. Which of the following results would occur in an unpreserved urine specimen? that has not been tested for 8 hours. Increased bacteria, increased RBCs, increased white blood cells, or increased cast. We know our limit is 2 hours at room temperature. More than 2 hours, bacteria will increase, RBCs and white blood cells will decrease because of lysis. Cast will not be affected by the time. So here you left the urine 8 hours and unpreserved. So what do you think increased bacteria? So this will be the correct answer. Here's the correct answer: increased bacteria, because it will may proliferate in unpreserved specimen held at room temperature for prolonged time. RBCs or white blood cells may be underreported as a result of lysing that may occur. There is no reason would cause hyaline cast to increase in the urine held at room temperature for prolonged time. Okay. Question number 2. A new medical laboratory scientist semi-annual competency assessment, including performing a manual microscopic examination of urine specimen that was collected an hour and a half earlier, 1.5 hours. The results were compared to the completed result reported by the urine analysis department supervisor 1 hour earlier. So, this is the urine analysis reported by supervisor 1 hour, and this the new MLS, the technologist, after 1.5 hours. Here RBCs 25 to 50, white blood cells 5 to 10, epithelials moderate. For the staff reported RBCs 3 to 5, white blood cells 0 to 2, and epithelials few. So, our question: what is the possible explanation for the discrepancy between the supervisor and the new MLS result? As we see here, RBCs 25 to 50, here 3 to 5, white blood cells 5 to 10, but here 0 to 2. So, the urine sample was not from the original specimen. The new MLS mixed the specimen before pouring the urine into the adequate tube. The specimen was not tested within 2 hours. The sample was not centrifuged for corrected amount of time. So what is the possible explanation of this discrepancy between the supervisor and the new staff? Explanation is the sample was not centrifuged for correct amount of time. If we see the feedback, the new staff didn't centrifuge urine for correct amount of time. As we mentioned that in SOP, standard operating policy, should mention the time and the speed of centrifugation. And all lab staff should follow the standard operating policy to reduce and eliminate the inconsistency in reporting. Question number 3. 65 years old female patient was instructed to collect a clean catch midstream urine as a part of a wellness physical and deliver it to the laboratory. The urine analysis results were as follows: color yellow, clarity cloudy, glucose negative, protein negative, oxygen normal, pH 6, blood والكيتون والنيترate negative, nitrate positive, leukocyte traces, specific gravity 1.025. For microscopic, RBC 0 to 2, white blood cells 0 3, epithelial moderate, bacteria plus 3, and mucus threads moderate. All of the following constituents indicate that the specimen is not a clean catch midstream specimen, except number of mucus threads per low power field, increased bacterial growth, moderate number of epithelial cells, or the count of RBCs is 0 to 2. This is not indicating clean catch midstream. All these indicating the specimen is not clean catch midstream, except one of these not related to the clean catch. الميوكس ولا البكتيريا ولا الابيثيليال cells ولا RBCs. The correct answer is these. All of these can be a contamination during collection, which is the pre-analytical phase. The feedback is RBCs. It is a normal in a urine microscopic result and is not related to clean catch urine sample. But mucus, bacteria, and epithelial cells indicate external contamination due to improper collection and not a clean catch. So how I will know that clean catch midstream collection done or not? If I see mucus, bacteria, and epithelial cells very high and the rest of the urine is normal. Question number 4. Which of the following can cause false negative microscopic result? Failing to mix the specimen, testing urine with pH 5, testing urine with specific gravity 1.030, using too small of urine volume for resuspension. What of these will give false negative microscopic result? Is not related. Specific gravity is not related. We have two here. Too small volume for urine and too small volume for urine will give false positive, not false negative. So failing to mix the specimen will give false negative result. So this is the correct answer. And this is the feedback. The correct answer is failing to mix the sample. Question number 5. Which of these procedures may decrease the reliability of macroscopic urine sediment report? Mixing the specimen before transferring an aliquot to centrifuge tube, capping the centrifuge tube before centrifuging the aliquot, pouring off the supernatant after centrifugation and mixing the sediment in whatever volume of liquid remains, examining more than 20 high power field before reporting the result. Which procedure will decrease the reliability of the result? Pouring off supernatant after centrifugation and mixing the sediment in whatever volume of liquid remains. We mentioned before the volume for resuspension should be fixed and according the laboratory SOP. So the correct answer is number 3. Now we'll discuss the microscopic examination of urine sediment and staining technique. This will be in next video. Assalamu alaikum wa rahmatullahi wa barakatuh.